Hey everyone, welcome back to Doc for You. Today we're talking about a cough that just won't quit. If it's been more than 3 weeks, you might be thinking, maybe it's just taking longer to go away this time. But here's the truth. At that point, your cough is trying to tell you something. Let's break down what that might be, what you can try at home, and when you should see a doctor. We classify coughs by how long they last. If it's less than 3 weeks, it's acute, usually from a cold or a virus. 3 to 8 weeks, that's subacute. And if it's longer than 8 weeks, we call it chronic. Now, most people think, if it's not getting worse, I'll just wait it out. But the subacute phase matters a lot. The most common reason your cough sticks around in this stage is something called a post-infectious cough. Your body fought off the infection, but your airways are still irritated. And that can take a few weeks to calm down. But sometimes it's not just leftover inflammation. Asthma, acid reflux, and postnasal drip often start showing up around this time. If you catch those early, they're easier to manage, and you're less likely to end up with a cough that lasts for months. So if you've been coughing for over 3 weeks, it's not something to ignore. This is the time to start paying attention and maybe take action. Let's go through the top 5 causes of a persistent cough. First, postnasal drip, also called upper airway cough syndrome. This happens when mucus from your nose or sinuses slowly drips down the back of your throat. You might not even notice the drip itself. But if you're constantly clearing your throat, or your voice sounds raspy in the morning, this could be the cause. It's especially common with allergies, a lingering cold, or dry indoor air. Second, asthma. Now, not everyone with asthma has wheezing. Some people just have a dry, nagging cough, especially at night, when they lie down or after they exercise. This type is called cough variant asthma, and it can be easy to miss. If your cough comes and goes or seems triggered by cold air or physical activity, this is worth considering. If your cough gets worse at night or after exercise, this might be the reason. Third, acid reflux or GERD. Most people think reflux always causes heartburn, but that's not always true. Sometimes it just causes a dry cough, a little throat irritation, or feeling like you need to keep swallowing. If your cough flares up after meals, when you lie down, or if you sometimes wake up coughing at night, this might be the reason. Fourth, chronic bronchitis, usually found in smokers or former smokers. This causes a daily cough with mucus, and it sticks around for at least 3 months out of the year, for 2 years in a row. It's a form of COPD and something you don't want to ignore. And finally, your medications. Some blood pressure medications, especially ones called ACE inhibitors, like lisinopril or enalapril, are known for causing a dry cough. And the tricky part is, the cough might not start right away. It can begin weeks or even months after you start taking the drug. So if your cough started after a new medication, it's definitely something to check with your doctor. Now those are the top 5 causes of a persistent cough. But there's one more thing I want to mention. Not because it's common, but because it's important. In rare cases, a chronic cough can be an early sign of lung cancer, even without other symptoms like coughing up blood or weight loss. If your cough has lasted several weeks and there's no clear reason, especially if you're a smoker or over 50, it's smart to get it checked, just to be safe. Catching serious conditions early can make all the difference. Sometimes a cough is more than just annoying, it's your body raising a red flag. So when should you stop managing it at home and get checked right away? Here are some signs you shouldn't ignore, and what they might mean. Coughing up blood. This could point to a serious lung issue, like lung cancer, tuberculosis, or even a severe infection. It's rare, but it's never normal. Always get it checked. Unexplained weight loss. Losing weight without trying can be a sign of chronic infection, cancer, or a systemic illness. When it's combined with a persistent cough, it needs investigation. Night sweats. Waking up soaked in sweat, without a fever or room being hot, can be a sign of tuberculosis, or another infection that your immune system is fighting silently. Shortness of breath. If you feel like you can't catch your breath, even when resting, that could point to asthma, COPD, heart failure, or a lung problem like interstitial lung disease. Persistent chest pain. A deep ache, pressure, or tightness in your chest, especially if it worsens with breathing or coughing, could be related to pleurisy, pneumonia, or even cardiac issues. And just to be clear, these red flags matter regardless of how long you've had the cough. Even if it's only been a few days, if you're coughing up blood, losing weight, experiencing night sweats, chest pain, or shortness of breath, don't wait. see a doctor right away. If you're not experiencing any of those red flags and you're feeling okay otherwise, there are a few things you can safely try at home. First, keep things moist inside and out. Drink warm fluids like tea with honey to soothe your throat. And use a humidifier if the air in your room is dry. Both can help calm down irritated airways and reduce coughing, especially during the night or in dry climates. Second, try an over-the-counter antihistamine like cetirizine, loratadine, or fexofenadine. These are helpful if your cough is related to allergies or postnasal drip. Third, if you've got mucus, try guaifenesin to help loosen it and make it easier to clear. You might come across cough suppressants like dextromethorphan. While they can reduce coughing temporarily, they may also mask important symptoms, especially if there's an underlying condition that needs to be addressed. So for a cough that's lasted this long, it's usually better to avoid suppressants unless your doctor recommends them. Fourth, if you think reflux might be the issue, you can start by trying an over-the-counter acid reducer like omeprazole or famotidine. Take it once a day before breakfast and see if your symptoms improve over the next couple of weeks. In addition to that, try adjusting your habits to reduce reflux. Eat smaller meals, avoid lying down for at least 2 to 3 hours after eating, and limit spicy, greasy, or acidic foods. Even small changes here can make a big difference. And lastly, don't forget to check your medications. If your cough started after a new prescription, especially a blood pressure drug, ask your doctor if it could be the cause. If none of these steps help, or things get worse, don't wait. It's time to see a professional. If your cough isn't improving or you're noticing warning signs, it's time to visit your doctor or local clinic. They'll usually start with a chest X-ray to rule out anything serious like pneumonia or something structural. But in some cases, especially if the X-ray is normal but your symptoms persist, a chest CT scan may be needed to get a clearer look at your lungs. Depending on what your symptoms look like, they may also order lung function tests to check for asthma or COPD. Allergy testing, if postnasal drip or environmental triggers are suspected, a reflux evaluation, especially if GERD is suspected, or a medication review, to see if any of your current prescriptions might be contributing to the cough. The goal isn't just to stop the cough temporarily, it's to figure out why it's happening and treat the cause directly. So here's the bottom line. If your cough lasts more than 3 weeks, even if it seems minor, don't ignore it. Your body's trying to tell you something. Listen. Thanks for watching Doc4U. If you found this helpful, give it a like, hit subscribe, and share it with someone who's had a nagging cough. Stay informed, stay healthy, and I'll see you next time. Manage your health wisely and stay updated with real doctor tips. Doc4U. Trusted medical advice from a real doctor.